People often ask about exercises to restore vision. To understand how vision restoration works, it's important to first know why it gets worse. There are two main reasons vision deteriorates. The first mostly affects younger people. It's caused by nearsightedness or farsightedness. Astigmatism also falls into this group. All of these conditions can be treated. Normally, the lens of the eye should focus light directly on the retina. If the lens is too curved, the light focuses in front of the retina. This is nearsightedness. If the lens is too flat, the light focuses behind the retina. This is farsightedness. The shape of the lens is controlled by the ciliary muscle. When this muscle tenses, it stretches the lens, making it flatter. When it relaxes, the lens becomes more curved. Constantly using a computer, phone, or reading books at a young age forces the eyes to focus on nearby objects. As a result, near vision gets stronger while distance vision weakens. That's why most people who spend a lot of time looking at screens develop nearsightedness. On the other hand, people who work with long-distance vision, like truck drivers, often develop farsightedness. To restore balance, nearsighted people should spend 2 to 3 hours a day looking into the distance, while farsighted people should spend 2 to 3 hours focusing on nearby objects. One effective exercise can be done at a window. Stand about 30 to 40 centimeters from the window and stick a sheet of paper with small text on the glass. There should be something in the distance to focus on outside the window. The routine is simple. Focus on the text for 30 seconds, then look at the distant object for 30 seconds. Repeat this switch 5 or 7 times. After just one session, nearsighted people will notice they can see farther, and farsighted people will read small text more clearly. Doing these exercises regularly, several times a week, helps restore vision. Astigmatism is caused by uneven light refraction along different axes. It happens when the eyeball isn't perfectly round. A normal eye should be shaped like a perfect sphere for even refraction vertically and horizontally. When the eye muscles are tense unevenly, they can squeeze the eyeball and distort its shape, leading to poor refraction. To treat astigmatism, it's important to relax the eye muscles. Massage the areas around the eyes, outer, inner, upper and lower, 20 to 30 times each. Doing this a few times a day can help cure astigmatism in just a couple of weeks. The second group of eye problems is linked to poor blood circulation. This includes age-related vision decline, retinal spots and atrophy, cataracts and glaucoma. The eyes get their blood supply from the brain. When blood flow to the brain is disrupted, the eyes also suffer. The brain receives blood through arteries in the neck, but tension in the neck muscles can compress these arteries, reducing blood flow to both the brain and the eyes. To restore vision in cases caused by poor circulation, the first step is to improve blood flow to the brain. This can be done by relaxing the side and back neck muscles with static stretches. These stretches should be done at least 10 times a day. The more often, the better the results. There's also a way to directly improve blood flow to the eyeballs. The most effective method is warming. Simply placing your hands over your eyes isn't enough. It's recommended to use a small warm water bottle and place it over both eyes for 15 to 20 minutes. This boosts blood flow to the lens and retina. This procedure needs to be done regularly for several weeks or even months to help restore vision. Another method involves light pressure on the eye muscles or directly on the eyeballs. Moving the eyes helps expand blood vessels and increase circulation. Applying gentle pressure to the eyeballs is especially helpful for treating glaucoma. Glaucoma is caused by increased pressure in the front chamber of the eye. Normally, eye fluid flows from the front chamber to the back through tiny passages between the ciliary muscles. When these passages are blocked, fluid builds up, raising eye pressure. Pressing gently on the front of the eye helps move the fluid and clear the pathways. With this technique, glaucoma can be treated in just a couple of weeks. Retinal detachment happens when blood flow suddenly drops. This leads to tissue atrophy. The retina detaches and stops receiving blood. Laser treatment creates scar tissue, which can further reduce blood supply. Instead of surgery, it's better to use the previously described methods to restore blood flow to the eye. Corneal cataracts are actually the easiest to treat. The cloudiness of the cornea can be cleared up using powdered sugar. Just sprinkle a small amount of powdered sugar on your palm. Gently hold your eyelids open and blow the powder into your eye. This irritates the conjunctiva, the eye's mucous membrane, causing redness, discomfort, stinging, and sometimes pain. But the blood vessels expand, increasing blood flow to the cornea. Within a day or two, the cloudiness fades and the cornea clears up. All the methods described are based on understanding the root causes of eye problems. By practicing these techniques regularly, you can take control of your vision and restore it naturally, without surgery.